that's very important though, Pete. Let me go back. Usually the MRI is used anyway by the neurosurgeons here in the Detroit area and Ann Arbor, is to eliminate other causes, like a mass or a tumor or something else other than arteries or veins on the trigeminal nerve. And then it's usually for classic trigeminal to go ahead with the MVD, the gamma knife, or one of the percutaneous rhizotomy, the glycerol, or the balloon compression. They look for the classic shocks. The burning can many times be the result of letting the beating on the nerve go too long, and this is a tough one to describe. Some feel that the longer you wait, I use the analogy that if you sat there and put your finger on the table and you beat it with a hammer for a while, after a while you're going to cause a severe injury. Same thing with the trigeminal nerve. If an artery or a vein with the blood flowing through that is beating on that nerve, over time, it can turn into constant pain. And once it turns into constant pain, it's a little more difficult for a positive outcome. And a positive outcome of an MVD, when we call it the gold standard, is no pain, no meds. That's the best outcome. And you go for 5, 10, many people 20 years with no pain, no meds. Now, if you didn't have that outcome, it's not a failed MVD, it's just a different outcome. And back to Lynn's case, the difficulty there, I believe, Pete, was she was having the shocks near the eye in V1. And I believe she may still be having those. At 78, my memory is aging. And at times, Lynn will tell me that 10 times and I'll ask her again. But I believe she still has some of the shocks. So she's still on some of the anticonvulsants. No, I thought it removed the shocks in the eye, Pete.
Yeah, as she would call it, the burning turkey skewer in her eye feeling is gone.
Yeah. So in terms of that, her MVD was a success.
Oh, it was definitely a success. There's no question. Yeah. And she was atypical too, which was another further complication.
Good point. And the atypical is not taken away by the MVD usually. If you could be lucky, but if it's not, that's where you try other alternatives, other meds other than opiates. Opiates are a last resort.
Excuse me, Tim, do you want to call Dr. G just to at least try one more time?
I don't have a phone number for him.
Okay.
Well, let me look at my phone. I always talk to him via email. And so I told him, because he's so busy, if you're not there at 6 o'clock, we've got other stuff.
Okay, perfect. Well, then you can call an audible then. And while you're doing that, I'll just start off with our normal format for those who are new to this. So
go ahead.
I'm the host of this group in terms of the Zoom part of it. Tim Guth and Lynn Rupi are the leaders. So just to let you know, you can hear the videotape. We do record the entire meeting, but we want to respect your privacy. And so if there's anything you don't want to talk about, you can talk about it, but you don't want it to be recorded because these will be put up on YouTube. Please raise your hand, let us know. We'll definitely stop the recording during that time. But your questions are really important. So what you ask, your questions that you ask not only helps this group, it blesses people that watch it down the road. And this, it's up on YouTube, so anybody can watch them. So please ask those questions. You could ask the same question several times. That's what this group is about. It's a connection about what our experiences and how we've resolved them. And so you can make better decisions for yourself, how you want to go forward with your care. So when we do get to the question and answer part, which we may be starting right now, I'm going to manage the chat screen. If you want to ask questions that way, you can raise your hand. I'll try to keep you in order. or just if it's not too crazy, you can just post the question just verbally. So with that, we're going to turn it. Tim's still on the phone. I got to look. I should look at the screen. Once Tim gets back, we'll see where we want to go from there. And while he's on the phone, does anybody have something they want to share right now about experiences or where they're at? Or I see we got Roseanne here. It's nice to see Katie's back. This is fantastic.
So I'm just confused. Pete said that the MVD wouldn't work for the atypical, or you take a chance?
No. Again, always, last time I'll say I'm not a doctor. It definitely made a huge difference in Lynn's life. It's just apparently not as effective as the typical TN with is it the constant shocks, where she had different symptoms than at the standard classic TN. So
Okay.
it was her best choice compared to the options that were available at the time. And it's actually become as Tim said, the gold standard. So at the time it was fairly new. And unfortunately, the doctor who did the great surgery with her, he has passed. But yeah, I'm quite sure she would highly recommend it. And
Okay.
most people in this group who've had it would feel the same way.
I mean, Dr. Brown did recommend it for me. I'm just scared to do it. So I just try to, I get confused.
Dr. Brown is excellent. We met with him. We met with pretty much every doctor in the country. So 30 years, you see a lot of doctors. So he's fantastic.
Okay. All right.
Yeah, I would, again, as a layperson, I would trust his opinion. And you're
I trust his opinion. Oh, for sure.
Yeah, and you're in good hands. So that I would assume it's certainly one of the least invasive, and it's just none of these procedures are necessarily permanent. That's the challenge. So when you deal with pain, but I agree with Tim, though, the prognosis is typically quite a long time. And Lynn had 5 great years, and she still isn't anywhere near the level of pain medication that she was at prior to the MBD.
Okay.
Her husband,
I was going to try upper cervical chiropractor just to see and that's my last stop. If that doesn't work, then I got to take it to the next level.
Yeah. Well, that's how Lynn went through the same process,
Okay.
to figure out what to do, because brain surgery is it's not exactly something you just step up to right away. But
exactly.
I don't remember her recovery being all that challenging. I'm going to say her bunion surgery in her foot was far more discomforting to her. So
wow. Okay.
I mean, I have my issues are with my feet, so foot pain don't either. But
okay.
Question I have, Tony, do you have atypical or typical?
I have atypical. I have chronic burning, achy pain all day.
Yeah.
It's in my jaw. It's in my up near my temple, going in my ear and behind my ear.
Yeah.
But from what, Tony?
I'm sorry?
From what?
From my root canals.
Mm-hmm.
It set it off like electricity.
Yep.
Yeah.
It seems like the atypical does seem to often come from dental procedure action.
Yeah. Yeah.
Yeah.
I introduce myself. My name is Judy and I'm in Pittsburgh. We don't have a support group here in Pittsburgh. And so I joined the Zoom meetings for California and for Philadelphia. And I am very new to all of this. This is only my 3rd support meeting. I am encountering a lot of folks that have trigeminal neuralgia. I had a bout of that in the past, but thank God that was over. It was horrible. But my issue stemmed from a dental error. I had a crown put on, and the dentist put etching acid on the tooth, and then she immediately put the cement-filled crown on top of that. She didn't know that she was supposed to rinse off the etching acid. And a neurologist told me that I likely have nerve damage from the etching acid. But before I learned that, I didn't know what to do. So I had a root canal also. And I've learned since then that that doesn't help with nerve damage. And the root canal made me 5 times worse.
Let me just interrupt for a minute. that was a good, I didn't think I had a phone number for him. Dr. Guithikonda just called me back. I left a message on one of the numbers. He's been doing surgery since 8:30 last night. Dr. Guithikonda is known for brain surgery. And in fact, a friend of my sister's in Flint, where I grew up, Flint, Michigan, he came all the way down here to Detroit at the recommendation of the neurals in Flint. And he did brain surgery on this fella and was very successful. I don't know how many years ago. He just called back and said he's been in surgery since 8:30 last night. He apologizes. He's coming on. He said, give him 5 minutes. He needs to connect to the invite, Pete. And I said, even if you're here like Dr. Malik did last time, just for questions, back to what Judy, what's your last name? Sorry.
Schiffbauer. But I wanted to ask, does anybody else have difficulty with the inferior alveolar nerve and the mandibular nerve? I do sometimes, my nerve damage, I think, has spread. I was listening to what you said, Tim, about how whenever pain is prolonged, it tends to damage the nerve, and my nerve damage is spreading.
That's what happened to me. It's spreading.
Yeah, my history that I can send, I've sent it to a number of people. I call it my ATN history. I've sent it to thousands of people, well, over 1,000 around the world. When I was part of an organization called ASAP, the fellow that ran it out of Virginia passed away. As American Society for Action on Pain, it was mainly for atypical type people where it was constant pain. And he was a big proponent. In fact, being an executive at General Motors and having had to retire at 52 due to this, and being on 480 milligrams of morphine a day, I was one of the people, my daughter and I, the first time I ever carried a picket sign was in DC against the DEA. Lord, she's 46. Had to be 25 years ago. We carried a picket sign on the Capitol grounds. We had what do they call it? A request or authorization. And so we picketed for about 2 hours, and then the heavens opened up, and it was like God saying, okay, guys, you had your 2 hours, now get out of the rain. We ended up coincidentally going to the Capitol around the back, and the people let us in compared to the January 6/21 riot or insurrection or visit, as the Republicans would say. Sorry about that if you're a Republican. They let us in the back door and we got out of the rain. So I've had quite a history of opiates. I've been as high as 600 milligrams. I'm down to 240 now. Our last pain specialist, trying to talk faster before Doc comes on, Doctor just was diagnosed at University of Michigan a year ago with ALS. And by the way, Melody, there's going to be an ALS walk at the Detroit Zoo, 10/1. I'll send out a notice later if you want to participate.
Yeah.
Oh, last night,
Thank you.
by the way, for any Democrats, we thought Gabby Gifford and Mark Kelly were going to be here in Detroit. They didn't show, but we saw Gabby Gifford's movie. I think you can get it online for $5.95 if you're anyone that might want to hear that. Oops, somebody dropped off. Must have been a Republican.
Hey.
Sorry about that.
Tim, I'm gonna mute you, man. Take it easy.
Yeah, I know it. I'm sorry I let into that. Slip that in. I see Dr. Guithikonda's on now. He's slow. There he is. Hi, doctor. You may need to unmute.
He's got it. He'll.
I chased Judy away, didn't I? I apologize. I didn't even get her last name, so she must have been the one. That's the first time I've ever done that, Pete. Apologize.
That's okay.
That's okay.
That's what I'm here for, Tim. Just to,
Yeah. Not to hear me rant about.
No, just to keep everybody in line.
If my intern has heard that, he dropped me. So doctor's not, I don't want to.
Close. You almost got red tagged. You almost got red tagged. Just
I know. That's the first time in how many years, 25 years I've
Hey, you're
run
passionate. Tim.
politics in.
You're
Yeah, I
passionate.
know. Very passionate.
That's okay. That's okay, Tim. We love you.
Yeah, thank you, dear.
Us Republicans can handle it. You're fine.
Yeah, right.
I'm
Hi,
right
doctor.
back.
Doctor, are you unmuted?
No, I'm not muted. No,
Yeah, no, we can hear you.
I didn't want to interrupt your conversations.
No, it's good you did.
Hello, everybody. I'm sorry. You can see I haven't really prepared because I've been up since like 8 p.m. last night. So it's been one of those
Yeah.
call days. So just
Yeah.
forgive me for just joining very casually, you know.
I introduced you, doctor, that you had been in surgery. And like I said, that's more important than
Yeah.
listening to our questions. So everybody's primed to ask their questions of you. So unless Dr. Guithikonda, I think I put in the note, spoke in 2016 and 2018, and Tim has been behind times here and not having him back since then. I realized that when I went back into our videos, about 40 of them online. But I need to preface this, and maybe I put it all in the letter. I don't know if the weather was bad in 18, Doc, but we only had Aaron running, myself, and one other fellow from Clarkston who was there. And we spent over an hour with Doctor working with this. It was almost like an appointment for this fella. But we went over and over and over the symptoms of this person. And I got to say one other thing. In my 25 years of running these meetings, Dr. Guithikonda is the only one, I didn't tell him. He woke me up at 8 o'clock the next morning and asked me how I thought the meeting went. This is after him spending an hour talking with one person. And usually, as Pete knows, we have a room full of people. We had usually anywhere from 10 to, I think the highest we had was 41 people at one time, about 10 years ago. Now that everything's online, prior to pandemic, we had less people, obviously, because, well, we stopped going to the hospital. And is Lynn Bailey on now from New Zealand?
I do not see New Zealand.
She was going to push her lunch hour to join us. I wouldn't have upset her with politics. From New Zealand, halfway around the world. She might jump in here. And we've had the UK on. I think I mentioned that in the letter. Yoko from Japan, who Lynn and I met years ago at a TNA. It was TNA then. Now it's Facial Pain Association. And she has a work commitment at this time, so she's not able to join. But I'll now that everybody's got their list of questions, I'll shut up and let you ask them, Dr. Guithikonda.
I'm happy to hear any concerns, questions, and see if I can have any answers.
Michael, question. Sorry.
Go ahead.
Go ahead, Michael.
Hi, doctor. Question I have for you is that how much efficacy for trigeminal neuralgia using gamma ray? They talk quite a bit about, gamma is a non-invasive type of technology compared to MVD. Can you comment about that?
Yeah, the gamma knife, we find about maybe a 70% relief. And, I have had patients, interestingly, where you do the gamma knife and the next day the pain is gone. And there is no way to have a control group or anything like that. And it's also very difficult to know what, which patient is going to respond and which one is not. And instances like that, I talked to a couple of my friends, they had a similar situation where the pain relief is almost instantaneous. Next morning they wake up and they have no pain. And you wonder what, mechanism that the gamma knife or the radiation has, done to the nerve to get rid of the pain so quickly. But then having said that, it's equally, one has to tell the patient that the pain probably is going to come back in 6 months. The recurrence rate is significantly high with the gamma knife, almost 50%, I think, what I would call recurrence. So in whether it's going to be full blown, I think that's hard to know. And on occasion, we have done a second gamma knife treatment in some patients where the pain has come back, and for whatever other reasons that we don't want to do any other, modalities of treatment as late as 6 months or sometimes even 2 years later, So
You
the rest-
find those, doctor, do you find that usually somebody selects that because they don't want to undergo brain surgery, actually opening the head with the MVD? Why someone would select the GK over the MVD?
Yeah, so, interestingly, as much as MVD is supposed to be a good treatment, and we do the MRI to really look for a vessel or a blood vessel compressing the nerve, you don't always find it. And so then, it's almost like a 20 to 30% what we call a negative explorations, where you do all the procedure, do the craniotomy and open the head up and go look at the nerve, and you don't see a big artery compressing, which then for the surgeon becomes kind of disappointing to say, oh my God, I wish I found something, because the success rate of the pain relief, if they do find something like a big artery, is almost 100%. I have like a few patients with 100% relief going as long as 10 years or something like that. So that's what we look for. And so the MVD, unfortunately, in those 30% with the negative exploration, are the patients that, somehow have a recurrence of pain, even though they have gone through a major brain surgery. That's the unfortunate, fact we have to live with.
Can I follow up with a
ahead.
second question? There's a technology called proton therapy. Essentially, proton have a type of very special characteristic that they dump the energy called the Bragg peaks at a certain distance from the beam source. And so that the damage of the beam when they come in is essentially lesser than the X-ray through your brain. Have you heard of any place that they use the proton beams for trigeminal neuralgia?
So, when we do the gamma knife, basically, we place one, what we call a shot or an isocenter, which is like a 4 millimeter shot right in the nerve. So proton beam or a Bragg peak, as you mentioned, is where you are concerned about the collateral damage that one may suffer from the radiation, like conventional, what we call an external radiation or IMRT or one of those things. But in proton beam, it's usually that concern for, the adjacent parts of the brain suffering any damage with gamma knife is so minuscule. I don't know anybody who would say proton beam is the treatment of choice for trigeminal neuralgia at all. So it's, if you have, like, say, a 2 centimeter tumor that's close to, like, say, the optic nerve or something like that, a vital structure or a brain stem, you're treating a 2 centimeter tumor and you want that rapid fall off, what we call, in the proton beam or a Bragg peak, and I don't think that's a concern in trigeminal neuralgia with gamma knife.
Thank you.
Is that tied to the cyber knife, doctor?
Cyber knife is also like gamma knife, right? It's a different kind of radiation source, and cyber knife also works just like the gamma knife, but just a different radiation source, you know?
I meant, would that be another name for this proton therapy?
No,
That's totally different.
it's not.
Because the IRSA advised us years ago not to use the CyberKnife for trigeminal neuralgia because it's not as accurate. And I know it's being promoted by those people that have one in their location, and it can be used for other areas. But IRSA told us it should not be used for trigeminal for what you're saying, because it can damage, not being accurate, it can damage those like the brainstem, other areas around the trigeminal nerve. And we have an example of that, of a lady that joins us when she can. She had a cyber at the University of Chicago, and she's in severe agony. And the only thing I've had to recommend to her is to try the opiates that a number of us have had to use for dental related, where it's none of the surgeries, the 5 surgeries are applicable, nor the motor cortex. I guess the motor cortex could be tried, but I need to throw that in about the CyberKnife if anybody's considering that. How do you?
CyberKnife, if it is what we call a frameless, meaning there
It's
is
a net. Yeah.
exactly right. I mean, with a gamma knife, you put a metal frame and you're fixing the head bolted to the machine. So the precision goes up to 1 millimeter, 1.5 millimeter range. Whereas if you are doing a CyberKnife without the frame, and depending on what we call the face mask and things like that, so the accuracy goes down. You know, it may be 3 millimeters, 4 millimeters. So if the trigeminal nerve itself is 3 millimeter size, and you have a 3 millimeter inaccuracy, then you know, you may not even get the radiation where the trigeminal nerve is. It could be the tissue next to it. So that's the difference is more to do with the frameless or frame based, you know, where you have a frame that fixates the head that increases the accuracy.
Well, how many grays do you use for the gamma knife?
You know, we usually use 80 gray.
Right. That's what Beaumont uses. Dr. Copeland, who was in Midland and had great success, was using 90, knowing that it might cause more numbness, but he balanced, he talked with the patient, and unfortunately Copeland passed here. How time flies, it's probably been 5 years now.
Yeah.
Since, you know, but he was having great success. He balanced the chance of numbness with removing the pain, and they would usually use 90. And he had one patient, as you said earlier, she came off the table and her pain was gone. So that's only one now out of, he had done many on the West Coast. He stopped doing the MVD because I think he had done 100 of them, and he had a couple that just were a mess, and he didn't feel that he was that good at it. So he sent patients south to Beaumont or to Henry Ford here or to you to have the MVDs. God bless him. He had other complications from earlier issues without getting into that.
The MVD is one of those procedures where you really need to be so precise in what you do, because the error, there's no room for error. Period.
Right.
I mean, you can't even move half, 1 centimeter or half centimeter this way or that way, because you may lose hearing. I mean, of all the MVDs that I have done, my incidence of hearing loss is 0%.
Yeah.
Had anybody lose hearing,
Yeah.
So same thing with the stroke. So, but that's where you have to be so precise in doing that. Otherwise, that's why I don't even monitor the facial nerve. I tell patients, in my hands, any facial paralysis is 0. And same thing with hearing. So one of the audiologists that we do monitor the what we call the brainstem evoked potential, which is the hearing, during surgery, and the girl was commenting, "This is the most steadiest audiogram that I monitored ever in forever."
Yeah.
So that's what the the technique for decompression without any kind of manipulation of the hearing nerves or the facial nerve, none of that,
That's why the doctors in Flint sent Dewey Lane down to you, doctor, for brain surgery, because you're known for such accuracy, for which we all appreciate.
Yeah.
So that, I have a question. So the MVD will work on atypical? If they could, like, if they see, say you could see my issue, it'll work on the atypical chronic pain?
So the problem is like, how do we define atypical facial pain, right? I mean, the classic pain is if you touch, it provokes pain, then it is a classic trigeminal neuralgia, right? And on the other hand, we have patients that come in and they are touching their face constantly and saying, this is causing pain. And so these are all like, observations. And then if the pain is extending, you take the picture of the face and the pain is going beyond the trigeminal nerve, for example, into the upper neck or behind the ear. So those are all atypical areas where the trigeminal nerve doesn't go. So those are the kind of things where we start talking about the atypical facial pain, the distribution and the location, and not the usual sharp shooting electric shocks like pain and all that stuff, So, and then, the problem is, it's not like, black and white. So that's where when you say somebody is atypical, or you end up exploring, because if there's no alternatives and, you have tried everything else, and, you give the benefit of doubt and say, okay, we'll do the exploration and see if we find something,
But what if they can see my problem? Like the doctor could see my issue, the artery or blood vessel pressing on the trigeminal nerve. I just have constant pain in my face.
Mm-hmm.
It's all my lower jaw. It's coming down from my temple across the cheek.
Yeah. So they found a blood vessel, and the reason for them telling you it's atypical is what?
No. The doctor actually said I had trigeminal neuralgia.
Yeah.
The second doctor, the first doctor I went to said it was atypical and I needed a nerve stimulator. Then I went to see Dr. Brown and he said it was trigeminal neuralgia. And the only thing I can do is an MVD.
Mm-hmm.
So, I mean, I believe what he says, but I'm just, it's just confusing. That's all.
Is that Tony? Is that
Yes, it is.
Oh, hi, Tony.
Hi.
Just check. I thought it was. Sorry, Doc.
So that's where it is, the conclusion of atypical versus trigeminal neuralgia, it's not always black and white,
Mm-hmm.
So that's where I think, as human beings and as physicians, we talk to the patients, and when we hear the story, the interpretation of one may not necessarily be the same in every patient with the other doctor,
Yeah,
So-
I don't have shocks. I don't have that.
If you have the pain, just like you're showing, like what we call the V2 and V3, right? The upper lip and the lower jaw, upper lip being V2, branch of the trigeminal nerve, and the lower jaw is the V3 trigeminal nerve. And the distribution sounds like trigeminal pain. Whether it is typical or atypical is more or less the description of the pain. Then, the location fits with either one, in your instance, for example.
Don't
Okay.
share with them what you think caused it.
Are there
Might
any
be factors too.
anything that brings on the pain, or?
My pain is constant and it gets worse with the weather. Forget the rain and the cold. It's bad.
Yeah.
I could be like, I can't even move my jaw.
Yeah.
Tony, though, you know what caused it, though, right? Share that with doctor. You
The
think
root canals.
Yeah, so that's kind of one of those problems, where we see where a lot of the patients have gone to the dentist, and as you know, there is a branch of the trigeminal nerve that goes through the mandible, and where the root is going down into the mandible could be right next to the branch of the trigeminal nerve called the lingual nerve. And so the problem is when that nerve is injured, it sends off bad signals backwards into the main branch.
Oh my gosh.
And then you get the pain coming backwards into the lower jaw and all that.
And then it never goes away, which I don't understand. It just never goes away. I've had this for a year.
And you had a root canal?
Yes, last September. And the pain is getting worse now.
Pain come instantly right after the root canal?
Oh my God. Yeah, right away. I was screaming. Yes.
So I think the nerve is probably injured, and then, it's called like a retrograde damage to the main nerve is probably causing some of that. And what medications have you tried though?
I am taking gabapentin, like 2,100 milligrams, and oxcarbazepine.
What is it?
Oxcarbazepine, if I'm saying it right.
Oxcarbazepine.
Yeah, that's it. That's it.
Yeah.
And then I have a topical compound with lidocaine, baclofen, tryptoline. It's a compound that you put on your face. So I have a lot that I'm using.
She's near the city. She's near New York. There was a neurologist out there, Dr. Jeff Cohen, would prescribe, try as a last resort, opiates. But I tried to find him, and I think he's retired. Clara Patterson had me come to the city back in '99 and listen to him, and I'd had contact with him since then. But I think he's retired because his office shows closed. Do you know anybody in New York City, doctor, that's a pain specialist?
Honestly, I don't know.
For everybody, anybody in Michigan, I think most of you know, I have a new pain specialist, Dr. Mark Munier, who's taking any of our trigeminal patients, atypical type, that can't be resolved with one of the procedures, and he's continuing the medication that our previous doctor who was diagnosed with ALS cannot continue. Try to throw that in there. Any more questions for Dr. Guithikonda? Did you get
I do
everything?
have a quick question for doctor.
Yeah.
Do you see any advancements of the therapeutic and also diagnostics for trigeminal neuralgia within the next 2, 3, 5 years that we don't have?
The things have kind of come to a plateau where the resolution of the MRI is pretty good. So I think, obviously you want to get an MRI that's, a higher resolution MRI to see the nerves. And then the medical treatment, I think, has come to also a plateau with the trileptal. Probably, I was listening to a podcast myself about this trigeminal neuralgia from somebody at UCLA. And they feel that trileptal is probably the better drug of choice more than anything else.
What was that, doctor? What?
Trileptal, that's the oxycarbazepine. Yeah. And she was pushing the dose pretty high, actually, almost like 1,800 milligrams or something like that to see if that helps, And then, of course, I tell the patients, unless we see something very definitely abnormal, always try the gamma knife and see what happens, as opposed to going to the microvascular decompression. And nothing is lost by doing that,
You don't get numbness, doc, at 80 degrees or 80 rays, you don't get numbness?
At 80, you don't really see the numbness. But when I had treated them second time with maybe a 40 gray, they do end up with some numbness, because by then they already had one gamma knife. and their pain is pretty bad. So now they are willing to live with some numbness. But you know, it's like going to a dentist and coming out and say how miserable your face is, right? And expecting the patient to live with that day in and day out. I mean, that's not fair either, you know. You can say, well, I warned you. Well, warning is not the same as living with it, you know. So,
Doctor, I have a question. Where is the numbness? Where does the numbness occur?
where the trigeminal nerve? Because when you do the gamma knife, there is no selective way of, you know, doing the gamma knife for the branches of the trigeminal nerve. Because there are 3 branches, right? One goes to the forehead, mid-face, and the lower jaw. But where we actually give the gamma knife, the location near the brainstem, the nerve all comes together into one little tiny nerve. So we treat that one nerve. So you can't really selectively say, you know, we're going to treat the part of the nerve that goes to the lower jaw. So if you do end up with numbness, it could be pretty much the whole face, you know. Most important thing that we do worry about is losing the sensation of the cornea. And that's pretty disastrous, because if you can't feel your cornea, then, you know, you have the corneal abrasions, and sometimes patients end up with such severe pain, they want their eye removed, you know, patients can, so, but that's pretty rare. I probably have seen it only twice with that kind of a painful condition, you know. So that's, fortunately, it's not a common problem, you know. Then you end up with you know, escalating to other treatments. Excuse me for 1 second.
Go ahead, Don.
Get to the other, you know, levels, you know. Can I just take this one call for a quick
Yeah.
second?
Go ahead. The one lady,
Who's on the phone? Could somebody explain to me what an MBD is?
that's the microvascular decompression. We call it the gold standard if you have the applicable symptoms, which are the shocks in the face. I'd forgotten that because I didn't have classic. Rubbing the face, he said people come in saying whenever I rub my face, I get those shocks. So you can look that up online, and there'll be quite a description of that microvascular decompressor. Just put in all caps MVD.
This is done just for trigeminal neuralgia?
Just for classic trigeminal neuralgia. Is that what you have?
No, I do not. I know that for sure.
What
I
do you-
have damage to the inferior alveolar nerve.
Yeah, we should talk.
It's spreading.
Yeah, we should talk about that. That's similar to Tony. Mine was from an infected root canal some 25, 30 years ago. And mine damaged the infraorbital branch off V2, which goes above the upper teeth where I had my root canal. And I let it go. I had infection in there. Oh, Lord. I had 24 bouts of sinusitis. Doctor's back. I'll shut up for a minute. We can talk more
That's
about
okay.
that.
Go ahead. I have to go. I got another call. I'm on call till tomorrow morning.
You have to go?
So, anybody else has any other questions?
Yeah.
Doctor, I just want to say thanks so much for being with us, especially knowing that you had a really long day today.
Yeah.
Do you have time for me to ask you a question? I do not have trigeminal neuralgia. In fact, I don't have any diagnosis at all. I've been working on a diagnosis for 2.5 years. A dentist in Florida left etching acid on my tooth when she glued the crown on top of that. And a neurologist told me that the etching acid probably damaged my nerves. And he didn't say which ones, but I believe it's the inferior alveolar nerve. But it is also spread to my mandibular nerve and trigeminal nerve because I have tingling here, pain behind my ear, pressure in the back of my head. And I'm concerned because not only is the nerve damage spreading, but it's causing neuromuscular problems for me now. I have twitching in my muscles, in my calves, and my arms, and I've had.
We lost your voice.
Your audio dropped out.
Oh, I've had tingling and weakness at times. Can you hear me?
Yeah.
And did you hear me say I have twitching in my calves, my thighs, and my arms? Have you ever encountered any other patients from which the oral nerve damage has led to nerve damage or kicked up glia, microglia?
It probably has to do with how it is affecting you overall. I mean, pain, as you know, it can cause a lot of side effects with, a lot of chemical imbalance in the body and things like that, the pain. So one thing I may suggest, you're talking about the neck and all that. Did you try acupuncture or anything?
No, I found an article online for persistent dentoalveolar pain, oral exercises, and I do those many times a day where I move my jaw laterally.
Yeah, you can do all that, but for the neck pain and all that, I think not a bad idea to think about acupuncture and see how that works out for you.
I'm also trying to find out whether there is something wrong with I didn't know what to do for the pain. No one was diagnosing me. So I had a root canal, which was a big mistake. It made me 5 times worse. And they found through a CT scan that I did have an untreated nerve in that tooth. So whenever they retreated it, I did have about a 35% improvement. But do you think that there still could be more nerve tissue in there that is causing this to kick up?
Well, I mean, once there is a partial injury to the nerve, it's kind of one of those things. Anything more you do, it's only going to get worse, because there's no way they can regenerate the nerve itself. You see, that's the unfortunate problem.
You started to help her, doctor. I don't know what your position is on the use of opiates, but I've dealt with thousands of people around the world as a last resort, and at least they can live with it. Like you say, you can't repair a damaged nerve.
Exactly.
But the issue is you want to live your life comfortably, which I've done with opiates for 25 years. The pain is not gone completely.
I think, like I said, other things like hypnosis, meditation, acupuncture, these are all things I think definitely do have a role to play in pain management, no matter what the problem is,
Yeah.
What kind of an acupuncturist would you look for? How would I go about that?
I know someone personally in Ypsilanti, but I was looking in the yellow pages, and if you go to Yelp and then look for an acupuncturist in your neighborhood, you do find some names, believe it or not.
I'm in Pittsburgh, by the way.
Pardon?
Yeah.
He's in Pittsburgh.
Yeah, Yelp is the app, as you all know, right?
Yellow pages for online.
Have you ever recommended a nerve graft?
No, I didn't hear about that. But again, I don't know what the success rate is. It's pretty low, I think. Finding the nerve is not the easiest thing, first of all. So unless somebody really, really specializes in that, So
Like you said, the more you dig, the more problems you cause.
yeah. So I have to go.
Yeah. Thank you, doctor.
Thank you.
Thank
luck.
you for being
Thank
here.
you.
Okay, take care, Tim. Good to see you.
Thanks, doc. Stay
Bye.
on, Pittsburgh. We need to talk.
All right. Bye-bye.
Yeah. Thanks, doc.
Thank you.
I'll get you back earlier this time. Sorry. No, what you're talking about is the same thing as Tony. I've dealt with, I hate to say thousands because you sound like an idiot, but mine, as I was starting to tell you, damage, only God knows for sure, but Tim is pretty sure because it's my body. It damaged the infraorbital branch over the off V2. I had 24 bouts of sinusitis, bronchitis, pneumonia in a 14-month period. So that's like every 2 weeks. I was back to the doctor getting Z-Pack or something. Finally, God love him, he saved my life 2 or 3 times. My brother-in-law, Donna's brother, was a radiologist, in Milwaukee, and he found a doctor at Emory in Atlanta. And I went down there and he did a thermogram. And in 20 minutes, he recommended methadone or morphine. And when I came back, yeah, I know your eyes. I did try meth in December with this last doctor, and I had too many side effects. That was after 25 years I tried it. But I've been as high as, I don't know if you were on, as high as 600 milligrams of morphine a day. I'm down to 240 right now. That's a long story without getting into that. I remember the first time I had a lady in Australia, Diane O'Callaghan, and it took me 6 months for her to give me her address so I could mail her material on the use of morphine. She was over by Perth, and finally she gave it to me, and I recommended she ask her doctor. She said, well, I don't think we have morphine in Australia. I said, well, take a shot at it. She got 50 milligrams a day of morphine after 13 years of suffering. And because the doctors start, it took me 4 months to get to 480 milligrams, which I was on for about 15 years. Depending on changing doctors, you get different views on how much will really work. And I've been through 5 or 6 doctors here. Some died, some moved out of state. The last one just got ALS. God love him. And but we're trying for Tony to find somebody. There's got to be somebody, Tony, in the city, if you're willing to try it. Like Doc said, once you start playing with that nerve and acupuncture, some people have had minor relief, a day or two, and the pain's back. That's just my experience. Maybe there's somebody out there that can really help somebody. As you can see, I've had a vocal cord issue too. It's either from silent GERD or me screaming when my grandkids were dancing in Disney World. Being an idiot 2 or 3 years ago, I don't know which. I won't say that. But the only answer really for that type pain, based on me dealing with, like I say, I should say hundreds rather than thousands. It sounds more reasonable. But when we had the ASAP group, we had people from all over the world, American Society for Action on Pain, till the fellow passed away, Skip Baker, down in Virginia. When I was saying we picketed the DEA on the Capitol grounds. It was fun for the day. In fact, this doctor at Emory was given an award at that meeting by Skip Baker, because he was kind of like the doctor of last resort. People went to him. I'll have to say before he asked the question, 2 or 3 years after I saw him, he left, and would you believe Purdue hired him, and he was their senior VP of government relations through the OxyContin issue. And I offered to go anywhere, any place on my dime for the Purdue people and the Sackler family to say that there is a place for morphine and opiates. Just so happens that they oversold the Oxy issue and now have paid out, I think the last thing was $650 billion. I guess she didn't want opiates. She dropped off in Pittsburgh.
Got a connection issue.
Oh, there she is. I thought you dropped off. Yeah, talk to me separate. I'm at tagdude@webtv.net. I can send you my ATN history. And I'm just telling you, like Doc said, that's the best thing he could have said. The more you play with that nerve, the worse it's going to get once it's injured. Now, and the thing I didn't get to ask him, but I know it like I was a neurosurgeon because I've heard it so much in 25 years. The problem in diagnosing it is some people have a compression on the MRI and they have no pain, and other people have pain and no compression. So what does that leave a doctor? It leaves a doctor almost to be a psychiatrist or a psychologist in listening to the patient. Most of our neuros here will say, what I do is listen to the patient, listen to their history. And the main thing people don't bring up a lot of times is the pain started after a dental procedure. 62%, Casey told us, I don't know, 5-10 years ago, that 62% in the TNA database, 62% of the people went to a dentist first because it felt like a dental problem, felt like an abscessed tooth. And what happened a lot of times is, oh yeah, got a root canal, because dentists aren't TN specialists. We've tried to train the dental community here in the Detroit area. God almighty, it's been 20 years now, because my son got married in Atlanta the same day we had that presentation. Doc Malik, Dr. Caspo, Lynn, and I had a 10-minute video that they played because my son thought I should be in Atlanta for his wedding rather than talking to a bunch of dentists. But we've tried to communicate, and my dentist knows it. The minute she gets trigeminal patients, she heads off or sends them to me or one of the neurosurgeons we have in the area. What time is it, Peter?
Yeah.
No, you're over your time.
Glad you brought this up. There's a couple questions stacked up for you, but
Okay,
I'm gonna be
I'll
stepping
shut
away.
up.
Lynn has an MRI. She's there. They may be taking out her gallbladder tomorrow. So anyways, but it's good news that we thought it was much worse than that. So I'm going to step away. Tim, I've made you a co-host, which should work. And just
I don't know how to use that chat feature. Maybe somebody else.
there's a red box in the corner, the lower right corner of your screen that says end. Just when
Says leave. Mine says leave.
Hmm.
Oh, there's chat. I see. There's
No,
a chat button. No, this is my
So-
wife's PC. I
So
don't know.
Pete, are they taking out her gallbladder?
well, we don't know. She's had a lot of
Oh.
side effects from her tamoxifen therapy from her breast cancer in 2018.
Yeah.
So we thought it was much worse than the gallbladder situation. So
But-
they hospitalized her yesterday, and she's in great spirits. It's just great to get all these tests get rolling because everything was taking so much time.
Get an
Right.
answer. And
Her MRI now will tell if that's what they think it is. They'll do a scope tomorrow, and if it's the gallbladder, they'll remove it. So
Okay.
she's in great hands. She's in great spirits. She wanted to be here. She's definitely here in spirit. So
Pete,
Aw.
Pete,
Tell
later,
her we wish her the best.
I will do that.
Pete, you have the name and email or something of all these people. I didn't recognize a lot of people.
I do. So Tim, I don't know if I've set this right because I've never had to leave early.
Yeah, I got it. I got the chat feature.
No, this is about ending. Somebody has to end the meeting. Do me a favor. Just text when you're all done. Text me that you're done.
I will.
And I'll pop on my mobile app and because Lynn will
Okay.
probably be sleeping, but I want to be there in case she needs me there.
Yeah,
Yeah.
definitely.
But I can
Yeah, gotta go.
remotely, I need to end it at some point. So there's a question from Katie. She wants to know. can
Yeah,
you
I
tell
see
us-
it.
You got it? Oh, you got the
Yeah.
chat feature up. That's
Yeah,
even
I
better.
got it up.
I
Please
need to
tell
listen
Lynn
more.
we love
Bye,
her.
Pete.
God bless.
Thank
Alright.
you, Peter.
God
Thank
bless.
you.
Yep.
I'm just gonna let
Thank
this
you.
roll. So if you're looking at my picture behind me, that's because I'm afraid to click end because it could turn it off for all of you. So
Okay.
you're gonna be
Yeah,
looking
we
Thanks,
at
know
the
you.
Pete.
picture.
You like to
Thank
look at your
you.
own picture.
Thank you so
Good
much.
night, everybody.
Thank you. Take care,
Good
Lynn.
night.
Thank
We'll
Thank
be
you.
fine.
Good
See you
night.
next month.
All right,
Okay.
bye.
Yeah, I can tell you. Who is that asking about the Galexa cream?
you, Tim.
Katie? Oh, okay.
Uh-huh.
Sorry.
Thank you for asking that because I understand this doctor invented that cream.
Yeah, he's a chemist. We call him doctor, but he's a PhD chemist. We found him, a lady in Kalamazoo, Michigan, found him, Dawn Monarch. And oh God, she's been through hell. She was on opiates for quite a while. I forget, well, we've got her scheduled for October 12th. We're going to have instead of just a Q&A in October, we went to interim months just with members talking between us. But since this Galexa cream worked so well for Dawn, we're going to have the chemist and Dawn online if she learns how to use a Zoom app by then. She's practicing with her brother or somebody. But what she does is, and I forget the contents of it, I can get the doctor to send you a sample of it Or for 1995, you can get a larger bottle of it. I just got one. I can, Katie, I've got one sitting down on the steps that I've had for about 10 years. It turns a little brown, but they say if you just wipe that off, I can mail you that sample. You gave me your address earlier today.
Tim, what is it?
It's a, I'm not a chemist, but it's a cream that's got certain contents, and let me see if I can get rid of this chat feature. It's in the way for me to show my face. Yeah, you just take it and rub it, as Dawn says. She didn't join us today. You just rub it wherever your pain is, and then it disappears. I was worried when I went last night. I thought, what the hell? It's going to look like I got my wife's powder on my face or something, but it just disappears. It blends into your skin, and it's got a content. Oh, that's right. Anybody that wants that, I do have multiple sheets of paper that will answer your question. Just email me your address, and I'm at Tag Dude. You can remember that. T is in Thomas, A is in Apple, G is in Giraffe, Dude, D is in Dog, U umbrella, D dog, E umbrella, E Edwards, Tag Dude at webtv.net, WEBTV.net. I think I'm the only one in the world that still has webtv.net. That's how far back I go. About 25 years ago, my kid said, well, you got to have an address, Dad, for the internet. I said, well, it's 4150 Cherrywood Drive, Troy, Michigan. No, come on, you got it. So they came up with TAG, that's my initials, Thomas Aloysius Guth, and you're a dude. So they put Tag Dude down. And now I'm writing to neurosurgeons with Tag Dude. They know me, they think I'm an idiot. And after they know me, they still think I'm an idiot. I had web TV back then. We're hooking up. I got 2 free 13 iPhones for switching from Infinity Comcast back to AT&T. And the people from DirecTV came on and said, our domain, whatever the hell that is, does not understand web TV. So I said, well, figure it out, because I ain't changing my my email address. I've given that to people I don't know.
Yeah.
The world. Back to trigeminal neuralgia, just to be fair to yourself, if you look it up in the medical books, it's a worst, and I'll try not to use vulgar language, but it's the worst pain known to mankind. It's referred to as a suicide condition. And we here in our support group have had 3 suicides, I hate to say, in our 25 years. 2 are about 28-year-olds, and they were all ladies. They had other issues, I think, too. And then we had another 38-year-old, God bless her. And we had one in Norway that some of us out in Utah and myself were working with. And the lady in Utah was interesting. She was caring for her mother, who was invalid. We got her to get on low-dose opiates finally. And the day after her mother died, she took her life. We didn't ask the family how, but that's the reason I tell you that is we understand how severe it is. That's why I try to, without being overbearing, tell you that once you have damage to one of those nerves, you've got to get, you can try, what's the number 8s, Tylenol 8s or whatever the hell they are, to try. I tried all that stuff before I went on morphine. Now, people will say, well, with the morphine, is the pain gone? No. But I can tell you 24 hours ahead of time, I can tell my wife whether it's going to rain or not, because the barometric pressure changes. She got me something to measure the barometric pressure about 6 months ago, and I still haven't hooked the damn thing up, because I know when the rain's coming, I know maybe 20 hours, not 24, but I know ahead of time it's coming, because there's still pain. Even with the morphine, It's like yesterday, I just had cervical injections. I've had them for 10 years in my neck. He's got this knife that if you looked at it, scare the hell out of you. I laid there, my blood pressure went to 89/58. And the nurse came to me and said, "Are you awake?" What she meant was, "Are you alive?" Because I've got a AAA, which is an aneurysm in the belly. Like Pete said, you live long enough, you're going to get a lot of shit. Sorry. But
Yeah.
so they've given me some heart meds to keep it below 120/80. But I did use with a psychologist biofeedback for about 5 years when I got this pain. And I think it's hard to remember 25 years ago, but Dr. Yanni here, it was before I had the morphine. He would hook electrodes to both sides of the face, and he would teach you how to relax. And on the side where the pain was, it showed up as when you have pain, I think the body reacts to blocking those blood vessels in the pain area, and the blood stops flowing through there. So it doesn't heal the nerve. Anyway, it reflected on his thing, and he would teach me how to relax. I did that every week for a year. And
Wow.
then I went every other month or every month for the next 2 or 3 years. And I think I told my wife yesterday about the nurse saying that. And a lot of times here at home, I take my blood pressure every night when I do go to bed. This last week, I think I fell asleep in the family room chair every night. God help for my wife. But we've had so much going on with people, with Tony and Katie and other people, that Facial Pain Association send to me. If they have atypical type pain, they will ship it people to me or Lynn, and then Lynn refers them to me because I've had so much success with opiates. If you can find somebody in your area, that's what, and I don't even know if Tony wants to try them, but it's sure as hell better than living with it for another year. Is try up. I mentioned this. Well, yeah, Melody, you can say, I got my internist to give you Norco, which is Tylenol
Right.
and what, hydromorphine or something.
It's codeine and yeah, basically
I
it's
don't think it's
codeine.
codeine. I don't think it's codeine. It's an opiate, a different one.
Oh, it's an opiate, yeah, but
You can look up
yeah.
Narco, NARCO. Now, but that's got Tylenol in it, and Tylenol can do damage to your liver.
Yeah,
Yeah. Oh, if you take it long enough. That's why I said
right.
to Melody, she's moved to my new pain specialist there. And at some point, talk to Dr. Munier, Melody, about whether you should worry about your liver.
Yeah.
We get our liver tested and our cholesterol every 3 months, so we know what's going on with our liver. But I've
I
never.
guess I should do that, Tim. I'm writing that down.
Munier won't do liver. We do that with our PCP.
Yeah, with
Check it
my
once a year.
primary.
Check it at least once a year. I don't think our guy does liver every 3, but we get our cholesterol and triglycerides med every 3 months from him.
Mine's through the roof, Tim, and
What is?
my cholesterol.
Oh yeah, you got to get on. See, he's giving me metformin mainly for weight reduction, but I'll give my spiel about Nutrisystem too. But I lost 30 pounds in 28 days with Nutrisystem. That
Wow.
2 or 3 years ago. Now, Don and I, we caught COVID, wore a mask everywhere but the bed, and we were up at Waldo, and somehow my wife and I and my daughter and son-in-law caught. We got the variant number 5, which my wife can't get enough sleep, and my type A personality has been magnified 3 to 5 times. So hell, I can't sleep if I did go to bed because I'm so tired. But it's interesting how number 5, a lot of people say, oh yeah, I had it back when it started. you ain't had number 5. I can tell you. I took Paxlovid, same schedule as President Biden, July 21st for 5 days. A few days later went negative. And then I don't know how long, within the next week, it kicked my ASS. I thought I was going to die. The only time in my life I thought I'm headed out. And then it got
Wow.
better over time. But it's left me with the 3 to 5, and my wife with this being tired. So
Yeah.
get the new one. This tummy
Well,
tuck,
Tim, how did you know you got number 5?
because that's the one hanging out now. Here's the kicker. We were up at the lake. So I call my doctor and he gives me, it wasn't Z-Pack, it was Cipro. No, I think it might have been because of my AAA, if the left lung, I lost my left lung due to some cervical surgery in 2019.
So you only have one lung?
No, that lung diaphragm.
Oh,
But if you don't have a diaphragm, you don't have a lung. I mean, you got a lung, but it just sits there and looks at you, right? It doesn't work.
oh, geez.
So I thought I was getting my left lung water filling up. So I call my doc back here in Troy, gives me the med. Day later, my wife gets a call. While I'm at the pharmacist in Petoskey, Michigan, I said to the pharmacist, hey, you got any of that COVID test? Yeah, here. You can get, if you're on Medicare, you can get 8 a month free from the government. So I said, well, give me 4 of those. I go back to the room with my wife's antibiotic. And I said, well, for the hell of it, my wife's got about 20 of these COVID tests, but they were all at home. I said, why don't I try one of these tests? Sure as hell, I tried and I got COVID. I don't have the filling of the lung. I got COVID. Down at test search, sure as hell. My daughter, my son-in-law, all 4 of us got COVID. Why do I know it's 5? Omicron, the latest one out there is 5. If you get it, that's what you got, is what I'm understanding. I didn't get it a year or 2 ago. I got it July this year. And that's
Yeah, so I got it this year too.
and it's
Tim.
very, very transmissible. I think you can walk by someone and get the damn thing.
Yeah.
They spit on you, you got it for sure. But anyway,
Yeah, I didn't get it until this year too.
yeah, but earlier, when did 5 come out? I don't know.
Well,
When did
I
you
don't
take-
know that's why I was asking, because I don't know when 5 came out.
I don't know if they can take a test and
So
know
I
it.
must have gotten 5, I guess.
Yeah, I don't know.
But you're right. 5
Then they-
kicked me too.
They call it long haul COVID or positivity rebound. Got heavy duty names, whatever the hell they mean.
Yeah.
Lineman kicked my
Yeah.
yeah. So
Yeah.
don't get it. I know. I thought the CDC and Fauci, and before he retires, would say put your damn mask back on, but they haven't. So I don't know. It's your best shot. We still wear a mask. We go to Kroger or anywhere else.
Yeah, me too.
Yeah. What are you drinking, Kate? Hey, what the doctor next door to my radiologist brother-in-law said, get this stuff. It's called Essentia, ESSENTIA. It's got a lot of electrolytes, Melody. And they said that would be good for you if you caught COVID. You can get it at Kroger and every place else. So we've been I got loads of it in the garage. Everywhere it was on sale. Tim buys it. Essentia.
Essentia, I'm writing it down.
Yes.
So
Yes,
how's Donna?
ENTIA.
How's Donna doing?
She sleeps.
A lot.
Well, she was on. I think she was on while I was printing out. Oh, that's right. I printed out I don't know where did I put the damn note I sent everybody. I was going to talk some of those issues, but we've got a question from, is that Pittsburgh?
Yes, I wanted to go back to that Galixa cream.
Yeah,
that
the
cream.
doctor invented. Is it a prescription cream?
No.
Or is it over the
No.
counter? Can you
No.
buy it online?
Yeah, you're
How
right.
do you get it? And have you used it and did it help? Because
I use it.
it helped,
It helping,
Tony.
Tony?
It helps a little. I rub it on my face like all day. It helps a little at this point. It does help a little.
I think it took Dawn, not once, but over a period of time. She's going to talk about it next month. I thought
Oh, it
she,
takes a while. It takes a while.
but
Where do you get it? How did you order yours?
I
Online?
ordered it on, well, Tim sent me a sample and then I liked it. So then I went online and ordered another jar
I've got his email address on that.
because I carry it around with me and I bring it everywhere I go.
Tony, can you put it anywhere on your face?
Yeah, I've been rubbing it all along that area of my jaw. Like I have the same problem like Judy. It's going in my jaw, it's spreading, it's now in behind my ears. I'm putting it everywhere.
Could you even put it, can you even put it on lips or
I do
Not-
put it on my lips, but not in my mouth.
not in the mouth? No.
No. Mm-mm.
Okay, gotcha.
And you said you take the Tylenol. What was it that you're taking?
I take Norco.
Norco, and it helps you?
Yes, it does.
Norco. I'm
it
gonna ask
does.
my doctor. I'm seeing him on the last 2 weeks from now, so I'm gonna ask him about it.
I would ask about it. I mean, it's been really, I don't know what I would have done. And thank God for Tim. I met Tim a few years ago, and because I have the atypical, and it was from dental, and
You had the
so
same pain like I do in Judy?
not the, I didn't have the, for me, it was where, how Tim said he had an infected root canal.
Yes.
I had the same situation and they started doing more dental work in there. They were, this was not where I'm living now. Unfortunately, I got a kind of rookie doctor and
Right.
yeah. And so he thought, oh, we need to do more and more. So there, finally it came, I had a lot done, teeth pulled, root canals, and all of that did damage,
Did you sue the doctor?
No,
Oh, okay.
I did not, but believe me, it crossed my mind.
Right.
Yeah, because, but I think he meant well, but I think he just didn't realize, TN is not, or nerve damage, doing nerve damage is not what they think they're, they don't think that they're doing that, to you. And
Okay.
it's, it's a touchy thing. You know what I'm saying?
Yeah.
They think they're helping you, but they're not. And, I learned the hard way. Don't let them, if you've got something like this going on, stop. Don't let them do any more. It's only going to make things worse,
Oh, yeah, I learned the hard way.
Yeah.
Back to the suing issue. Let me address that, Pittsburgh, and then we'll talk. I heard that from the other room, and I've got all this stuff for Doc on how to get a hold of him. The suing, after I had all that trouble and my dad was dying of cancer at the time, and I happened to be driving to Flint to work. My parents were 2 miles from my office. I was more focused on my dad, so I let that infection go too long. But after the family was on me, oh, you got to sue. I did take all my paperwork. In fact, the guy that did the root canal had retired, but I'd gone to that office in other words, I don't have any of my own teeth on the top. After a while, I just said to the oral surgeon, they wanted to put in, implants, 4 of them, because my German jaw is so damn strong. And I said, number one, I ain't going to pay that much money. And number 2, take them all out. I think I had 8 teeth left on the top. What? Yeah, I found. Yeah, thanks. So anyway, I give it to one of the top specialists in the Detroit area that handles suits, and they only charge you if they win one of those. I got all the paperwork from there, sent it to the guy. Like a couple weeks later, he called me, said, Tim, they did everything that you would do for a root canal. They had all the paperwork, the diagnosis, everything. So as far as I'm concerned, they followed the procedure that you would follow for a root canal. The diagnosis, the removal of the root, everything. So he said, I don't think it's worth pursuing. So anyway, I got the family off my back anyway for worrying that, well, let's sue. Because that's, like I said, it's the worst pain known to mankind. My wife, oh yeah, I forgot that. Pat, God bless her. The love of my life for 54 years as of this November 29th.
Oh, wow.
Packed my head in ice packs, like I sent you, Tony.
Right.
Yeah,
I read it.
yeah, ice packs on my face. I could not lay down because my head would throb. See, what happened was I went to a neurosurgeon and he opened the area up. And once they opened the area up from the root canal, the pain just accelerated. So for 9 months, I couldn't lay down because it throbbed. So I sat up on our couch downstairs. I'd been an executive at an early age at General Motors. I had to then retire at 52. That was after we found out the diagnosis. Kept ice. But Tony, you're putting toweling around it, right? Otherwise you can get frostbite from those things.
Oh, yes.
Anybody else that needs one, email me and I'll mail you one of these ice packs. Donna just ordered 10 more. So we've got the large ones and the small ones.
Thank you for that. Appreciate it.
Back to, this is a sample of Pittsburgh. I can send you, I don't know if you can see that brown on top. I've had those laying here for about 10 years.
But no, Tim, the brown is on even the new ones.
Oh, is it?
Yeah, so it's the same.
Yeah, because Dr. Bernstein said, just wipe the brown off and it worked, you know. I thought the brown was aging.
No, that comes like that.
How do you spell this stuff?
Gallixa. I asked Doc to send me more samples, Melody. So you're right here with me. I can give you one. But I got this package that I sent to who? Did I send that to you, Tony? On the Gallixa cream?
Oh, yeah. Oh, yeah, I
Probably
like this
attachment.
stuff. I like it.
No, but it's got all this. Somebody asked, what the hell's in it? I've got a pack
Yeah,
that
yeah.
if somebody wants that, and Doc's office number is, and it's Lawrence R. Bernstein. I thought did I put that in the letter? Under future. Future meetings. Yeah, I've got it in the letter if you got it. Dr. Larry Bernstein, PhD, founder of Guithikonda, located in Menlo Park, California. And Don Monarch will talk with us in October.
Okay.
He'll share the background. I can get you an early primer on it, primer. If you email me at tagdoit@webtv.net,
Okay.
and if you need an ice pack, let me know. But I can send you this package of, I don't know, there's about 15 or 20 pages of background about Gallixa cream. Before I forget though, I want to tell you guys, and I have a bunch of these too, if you don't have it, what TNA got a big donor that had a lot of money, gave them, I don't know, 100 grand or something to produce, I don't know if it's that much, this patient guide, which summarized all of the stuff that we've been dealing with in trifolds and cards. I refer to that in my letter too. If you got MS or you're a young patient committee, I've got all kinds of stuff I'm cleaning out my stuff because I think we'll meet on Zoom from now on. When we met at the hospital, I laid out 75 to 100 articles, and Lynn for 10 years kept saying, Tim, those are all online now. You don't have to lay them out. Finally got religion after 10 years. I'd really love Lynn if we could meet in the meeting because she gave the best hugs. I'm a hugger, but my wife warned me in my GM days that kind of was passe or old school, and women were taking my hugs as a negative, as we went into the next generation. So I quit the hugging, or I got my ass, my butt sued. So,
It's a different era. Hey, may I ask Melody? Melody, you
Sure.
mentioned a
Yeah.
drug medication called something.
Norco. It's Norco.
And what
And
is it? What is it?
It is an opioid.
It's a prescription?
Yeah,
script.
yeah, definitely that. And you're gonna have to find a pain management doctor to prescribe
Yeah,
it.
Yeah, but wait a minute, Mel. Remember how you got the first one? I got my
Oh.
PCP to give it
That's
to her
true.
while I
That's
got her
true.
into pain management. That's what I
That's
told
true.
you, Tony. You might get, if you got an internist that you've had for years, they might give you,
Yes,
I don't know, the pendulum is swung
maybe.
the wrong
Yeah.
way. Yeah, maybe. And this PCP has been our for 40 years. And I told her, I don't think I called him, but I had you tell him that I told you to see if he'd give you a script for 30 days until we
Right,
got into to Dr. Pepler.
right.
He's come down with ALS.
And at least that helped me try to see if it would help my pain. And that was definitely a catalyst to knowing that that would help my pain, because I think with this, you don't know if it's something that, that opioids would help you. But like Tim said, with the atypical, a lot of times it does. So it's worth giving it a try.
Okay.
And back to my point about taking 240 or 600, I mentioned quickly, but I'll restate it. The doctor at Emory wrote to my pain specialist back here, who had taken care of one of my cervical fusions. And we started at a low dose, and every week or every 2 weeks, he would up it a little bit. He might have started with 30 milligrams and then moved to 60. So it took 4 months for me to get to, at that time it was 480. We ended up, we would see how much it was helping me. And if it wasn't enough, he would increase it the next appointment. And again, it took from, I think it was January to April, maybe 3 months. To February.
That's another question. Does the Norco take away the pain, or does it just make it so that you don't care about it anymore? And the reason why I ask that is that I tried a CBD gummy that was a sample at one of the stores here, a health store. And
Yeah.
I felt the pain, but I just didn't care about it as much.
No, it's not like that, because I did that. I tried that too. And no, it takes away the pain.
Oh, that's even
Yes.
better.
And
Yes.
Melanie, is your pain completely gone, or are you just ready to live with it?
I think it's pretty much completely under control.
That's good. All of us are, everybody's not going to be the same.
So
Number one,
I gotta find somebody who's gonna give it to me. That's the problem. I gotta ask my neurologist.
Well, I was going to suggest that too, that neurologists sometimes will prescribe it.
yeah, I've only found 1 or 2 in my 25 years that neurologists
Yeah.
are willing to give it. They're just not It's not that they don't want to help you. They're just
Right.
not educated in
So then
opiate.
who do you get it from?
A pain specialist. Well,
What pain
like I told you.
specialist?
Or your primary care.
well,
Oh, she's a pain in the neck, I
Oh, well,
swear.
then forget him.
Yeah.
well,
Melody, how much do you take, may I ask? What's your dosage?
My dosage is, he prescribes me with every 4 to 6 hours. I don't always have to take quite that amount. And I have found, I don't know about you guys, but the pain can be better at some times and worse at other times. Or is it yours
weather related.
consistent?
Yeah. Well, what's the milligram on your bottle, Mel?
Okay, mine is the 5. Okay, but you can get 7. You can get 7. I think it's 7.5 or something
And
like
then
that.
10, and then 10.
Yeah. And a 10. Yeah.
And what
yeah.
kind of side effects do you have? I mean, can you drive?
Oh yeah.
The only
Oh,
thing
wow.
is, your intestinal system. You need to
Yeah,
use
the only thing,
Miralax.
right,
Yeah,
right,
Constipation.
I do take
Miralax is over the
Miralax.
counter.
Yeah,
Miralax.
I do use some of that, and I do use a stool softener,
Yeah.
every other day, that kind of thing. But,
Okay.
I do eat a lot of healthy things like, fiber and, fruit and
Mhm.
vegetables.
Oh,
So,
yeah,
I mean,
some-
I have a good diet going on. And I think that also helps, but, yeah, it has definitely been a game changer for me.
Okay.
Yeah.
Mentioned
Okay.
that I participate in the California group too, and you know that marijuana is legal there, and it's kind of made me think differently about legalizing marijuana because
I
I'd say more
know.
than half of the people in the group do take THC gummies, and they say that it really makes their
Judy,
pain
I did
bearable.
try it. I did try it, but for me, I don't know if I just took too much, but I got like feeling very I guess I would call it paranoid. I just felt weird. I didn't feel like myself,
You mean with THC?
Yeah.
Yeah, THC. Well, yeah.
I didn't like the feeling of that,
Here's I've got 3 things that I take every night, and not to get too descriptive here, but Tim is excellent with disposable enemas on myself. So I'm at 240. I got to be honest with you, ladies. I'm at 240 milligrams. Hopefully you don't have to take that. But anyway, every night you can get these at Costco, very inexpensive compared to Rite Aid. Rite Aid, they're called
Fiber Well.
Vitafusion Fiber Well, and I take 5 milligram fiber, aids digestive health, regularity support, and prebiotic. So I take 3 of those. Hang on, I take a lot more than that
Well, where'd you get those, Tim?
at Costco because they're less expensive than Rite Aid. You'll get them for
Okay.
half the price. These are big,
Uh-huh.
big bottles.
Oh my
I like
goodness.
these too because it's a probiotic.
What kind of fiber is it?
God knows, I don't know. It's
Well,
by
there's
it's by Vitafusion.
Okay.
She'll get to my enemas in a minute and ask me about those. I can get those too if you want to see them. Vitafusion, Vitafusion.
Got it.
Fiber Well. Here it is here. Can you see
Got
it?
it. Yep. Gummies.
I'm
Yeah.
sorry, everybody. I
Thank you.
have to go. But
And
be
then-
well, and I'll see you all next month.
Oh,
Okay.
Roseanne,
night.
how's your
Roseanne.
husband
How's he
doing?
Doing
doing?
well. He's doing well.
Is he?
Oh,
Yeah.
yeah. Oh, that's right. You're
Yeah.
not on opiates at all.
Yeah, the balloon
had-
compression. He's had
What did he have again?
he had a balloon compression.
Oh, that's right. Is
Yeah.
But
it-
he had like a little where things were not going so good for a little bit
So
there.
the first week, he had, right after the compression, he had a shock. And Dr. Brown said it just takes some time to,
Get used to,
to adjust. And thank
Yeah.
God he's been okay for now.
oh,
He's
thank
good.
God.
Is he
He's
still on?
he's still on some medication because he's too afraid to get off of it. He's on 600 milligrams of carbamazepine. But he got off the other 3 medications. He was on baclofen, latromagen, and dilantin.
What were his symptoms? Remind me.
He had TN,
Right.
well, he's TN1. He had just the
Yeah.
He had the
He had the
shocks.
classic.
very classic, yeah.
He had the
Yeah.
shocks. Yeah.
Yeah, but Dr.
Yeah.
Brown, as I said, I
Oh,
always
Dr.
told him
Brown's the best,
he-
really.
He saved his life, literally, and he's doing okay. We're worried every day. I'm worried every day. He tries to
Sure.
put it out of his head, but I worry every day.
You
and-
worry whether this is gonna come back, right?
Yeah, and about
Sure.
the nerve regenerating, and that's my unique fear. And I know one of the other members on this group had said he takes 5,000 milligrams of B12 and it helps with the pain. So I did start him on that sublingual B12. But now I'm worrying. I asked the doctor last night that we're on another meeting last night. And the doctor said that no, like that wouldn't regenerate the nerve, because I'm just so nervous. Like my life is like
Right.
about with nerve regenerating.
Yeah, I don't blame you.
But he does have another compression. Dr. Brown found another compression right underneath the trigeminal nerve. So, and that happened right after the MVD, right after his MVD.
Another compression.
Yeah, the
found-
MVD that I'm just starting to, I've always felt it's just the surgeon wasn't the surgeon for us. He, even though
Yeah,
he
that
did-
first one.
Yes,
Yeah, the first
in,
one.
in Manhattan, even though he said he did hundreds of MVDs and he's, on the
Yeah.
Facial Pain Association and part
Yeah.
of it and whatnot, and I researched him.
Yeah. Yeah.
Dr. Brown, so 3 weeks after the MVD, he had the shocks and came back 1,000 times worse, and then it was all over, V1, V2, and V3.
So he had the MVD prior to the balloon. Huh?
Yeah, he had the MVD October 2021, and he had the balloon October 20, and he had the MVD October 20 and the balloon February 2021.
It hasn't gone to constant pain. It still shocks.
He's been fine since the balloon. with-
Yes,
with
he's been
600
fine.
milligrams of carbamazepine.
But it's strictly shocks, not constant burning or anything.
He didn't really say much about the burning. It was more of just constant shocks. So the shocks were 24/7. Yeah, the shocks that was from the MVD. But I just believe that is something the first surgeon did, because
Yep, yep,
the compression,
yep.
as soon as he tapered off the anti-inflammatories, the pain came back. And the doctor kept saying, wait, it's the surgery, wait, it's the inflammation, give it time, give it time. But by
So-
December, I said, we can't give this time. It's not that, something
So
else.
So the MVD was done by a different neural in the.
Right,
What
yes.
was his name? You
I don't
remember?
want to mention if we're
Oh,
being
that's
safe.
right. Yeah,
Yeah, I mentioned it once before, but
maybe you can email me on the side.
yeah, he was
So,
from.
It's good for us to know,
Yeah,
you
yeah.
know.
Yeah,
I
because,
don't want to just, I mean,
Because
No,
you
no,
know,
I
really-
understand that. yeah.
it's not, Dr.
You
Brown,
don't want it on video.
right, just just said.
the
it
whole
just
thing is,
happened.
Dr. Brown, thank God you ended up with him,
Yeah.
thank God, because you
Yeah.
went to the right guy,
Yes.
really, the
No,
right
I
doctor.
do feel a lot of guilt because I was the one researching because he was in such pain.
Well,
and
how
I
do you
just-
know?
And that's the problem, like with dentists, we're trying, pain specialists, dentists, and you can research, but it doesn't mean, and I always feel with reviews can be written by anybody. Reviews can be written by
Right,
staff, reviews can be written by any,
right,
and I just don't trust any doctors. And
no,
I live
Well-
in Staten Island, and there's not really a great pool of dentists. Like I just found a dentist who has just knows of trigeminal, but I still
right,
don't want him going to the dentist.
But
So-
the main thing to start, we each know our own body.
Mhm.
So you start with your own body, look at what the symptoms are, and then listen to your doctor.
Yeah.
Dr. Guithikonda, who's in our area, and just like all of our other neuros here, if you have classic T1 shocks, the MVD can be what we call the gold standard.
Mhm.
If you do not have those shocks, and most people that the MVD is applicable to, the shocks just showed up. Where did they come from? I don't know. That's because of a compression.
Mhm.
But if you know that you had dental issues and your pain came right after that, we're all intelligent enough to know, and you've never had shocks, we're intelligent to know that the MVD may not be applicable, because Dr. Guithikonda said an important thing. I got to use the right word, the right adjective here when I get wound up. If you don't have those shocks, you can screw up. And I got a better word for that. Starts with F. You can screw up the nerve, which is you're not able to correct a nerve that you screwed up. That's why the shocks are so indicative of doing the gold standard at MVD.
Mhm.
And the gamma knife and not the cyber knife. He explained it better than I could. The gamma knife, they put a metal thing on you. You think you're back in the 1200s where they wore these metal helmets when they went out with a spear to fight each other. With the bloody cyber knife, they put a fishing net around your head. And hell, you can move your head, you burp or something while they're putting that ray on, like the woman in Kalamazoo. She's almost a, I don't want to say it. I keep forgetting we're on video. She's a mess when she gets on. I feel so bad for her. University of Chicago, you thought, God, my father-in-law, God bless him, was a graduate of that back in the 30s. University of Chicago, how can they screw something up? Mayo Clinic, how can they screw something up? You're better off, in my opinion, with somebody locally that, and let me warn you about something else, and this is good on video. You know how doctors used to get on the TNA site? They gave them $100 or $20 to get on the site.
Mhm.
Nobody checked how many MVDs they did, how good they were. They gave some contribution and they got their name on the site. Sorry, TNA and FPA.
Right.
That's how the neurosurgeon
Yeah.
got on the site.
Well,
Some people say, well, I went to the site and our neurosurgeons aren't on it. They decided not to get on it.
Right.
We know them. They know what they're doing. They've done hundreds of them.
Right.
Here.
And you're desperate
Well-
when you go to them. You want to just, and he said all the right things and you're just
right.
desperate and
Yeah.
you believe them. And now, then since then,
Roseanne, you didn't know about Dr. Brown. You didn't know, so you
I
can't
didn't.
blame yourself.
I can't
Right.
remember the hundreds of people that I've heard that story.
Yeah.
And I'm not saying Lynn and I are the be all end all. There's other support groups too. But after 25 years, and Lynn finally, she used to sit in the conference room across from me, and she was above the air duct. Air conditioning would blow down on her. She sat there with a cloth on her face all the time. I finally said to her, Lynn, we with ATN, I should ask Tony, does the wind ever bother you, Tony?
Oh, yeah, I have to cover my
Yes.
face. I'm not looking forward to the winter.
Yeah, you told me that before. See, up to now, I always said people with true ATN, the wind's never bothered me,
Mhm.
but classic people do.
Yeah.
So you could have some,
Yeah.
Yeah, the
wind
wind bothers
bothers you.
me. Yeah,
You could have
I'm
some.
ready. I'm
finally-
purchasing the winter hat that has the ear flaps.
right.
Because he
So I
goes
would say
outside
to
with
Lynn-
my son in the morning.
After about 10 years, I said, because that air conditioning bothers you, you might have some
Classic.
one and classic too. So
Yeah.
what did it
Yeah.
do? But she
That's
had
what I wanted
shock.
to ask the doctor just now. I didn't want to bother him though. I see how tired he was, the poor man. But if a compression, if the pain comes back 3 weeks after and another compression is found, like what does that mean? I mean, I
Well,
know they're not
Rosanna-
going to speak of the negligence of a doctor, but
Did
I was-
Dr. Brown find the new compression?
yes.
Does he think it's something that he has to go back in for? Or
He said he needs another MVD. But
Oh,
because
boy.
when we went in February and by the time we found Dr. Brown, because I went on the facial pain that weekend, that was their conference, and I contacted him that Monday. By the time you get all the paperwork in and I had to get all the MRIs to him, it took a while. But we started talking to him mid-February and by video conference, and he saw my husband's state and it was bad. So he said, you have to come to the hospital right now. And he was the most amazing person. He just grieved. He came on a
Yes.
Sunday. He
Yes.
came on a Sunday and he said, I just wanted you to see me,
Why
in
didn't he
person.
why didn't he do the MVD initially?
Because
Rather
my
than
husband had so much, as he said, PTSD from the first one. And he saw
Yep.
the state my husband was in. He says, well, I feel very comfortable doing the balloon compression. My
Okay.
husband just had the MVD in October. He did not want to open
He
it.
didn't want to do another one, yeah.
Yeah.
So
Yeah.
now speaking to other doctors, because I'm on another support group, actually just yet last night, And the doctor said, you can do repeat balloons. It doesn't, you could repeat them. I don't know if I'm correct, Tony. He said after 6 weeks if you needed to. He said balloon compressions can be repeated as many times as needed.
But
Dr.
does
Brown did say-
Dr. Brown doesn't think another balloon. He thinks go in for an MVD, right?
He said he has a compression. It developed under the trigeminal nerve. The first surgeon said he did a circumference round to see if there are any other compressions. He said there wasn't. I believed him. My husband was in heaven for the first 3 weeks. I just believe it was negligence of the surgeon.
Yeah, I do
believe
too.
that.
I do
believe that.
too.
Because it was
I do
alluded
too.
that he definitely moved a nerve or cauterized something else or moved an artery. Nerve, I've asked a few doctors through, I think our meetings here, can a nerve regenerate after 3 weeks? Not one of them said they really could. So the nerve might
No.
have rerouted, which I read in that Facial Pain Association book. The nerve could have rerouted from that.
Well, what does Dr. Brown think though?
Dr. Brown wouldn't comment because again, they're not going to discuss someone else's surgery. He just said,
Yeah. That's where it
Teflon
gets
is-
touchy.
yeah, the Teflon is placed correctly. That nerve, the original one is coating the trigeminal, but he said there is another compression. You need an MVD. But like I said, it was
Oh,
just
boy.
too soon. How do you open up a brain again?
Oh my gosh,
again.
your poor husband.
It
And
was
you,
You're
traumatizing.
not opening the brain, you know that.
You know what I mean?
You're outside the brain.
Opening the incision again
I just
and
mean
going
for the
through
people
and
on
worrying about infection.
and going
worrying
back
about
in
everything.
and going back
Yeah.
in.
My husband was at his wit's end, and so was I. P.S. I'm in therapy
Oh,
right now. Now I'm going to
Roseanne.
therapy. Did you?
Why is he going in again? Because the pain has gotten worse?
There's another compression,
Melanie,
Tim.
Melanie, back off for a minute, please.
Sorry.
Why? Did the pain get worse or he happened to see something on the MRI?
After 3 weeks of the first MVD, his MVD, the pain came back. We didn't get to see Dr. Brown until February. Did
Yeah, but he,
the MRI in February, and Dr. Brown said there's another compression, and that's where we
but he
went.
did the balloon though. Brown did the balloon.
Yes.
Okay, since the balloon, has the pain gotten worse?
Pain is no more.
Then why would you do an MVD just because you see what I said
We're
earlier?
not. No, I didn't. You're misunderstanding me. We're not. He's not.
No, he's not.
No, it's what Dr. Brown said. There is another compression. I can do an MVD. We chose the balloon. We haven't discussed it
Okay.
since because he's been on the medicine.
Okay.
We tapered off
Okay.
all the medicine. He's on the carbamazepine.
Okay,
And right now, and I attest some to God too, we're doing okay.
so Brown is not saying do another MVD now.
No, we haven't talked to Dr. Brown since,
Okay.
Maybe.
Well, what I stated quickly before was some people have compressions on the MRI and they have no pain. And some
Right.
people, yeah, and then the reverse of that.
Like,
So the MRI mainly is to, thanks to Katie. The MRI is mainly to, in our people, our neuros, is mainly to eliminate other causes
Right.
like a tumor or something else.
Right.
And then our doctors listen,
mhm,
LISTEN, to the patient
mhm,
before they determine whether they should do an MVD.
right,
And usually, unless it's unusual, it's classic
mhm,
TN shocks
mhm,
before you do an MVD.
right,
Because you're opening up the head, you're
right,
going next to the brain,
right.
and you're moving it away from the,
One of the other members of this group had the rhizotomy, and she spoke about it. How is she doing?
back in January, no pain, Mary Ellen.
Good.
Now,
Great.
hers, that's a good point for you. She had an MVD and the pain came back
Right.
10 years later. For
mhm,
those that want to look at that, in January of this year, Mary Ellen was on talking about her percutaneous rhizotomy. And then I had her neurosurgeon,
Yeah.
who's
mhm,
who's
I was
my
on-
neurosurgeon,
mhm,
also Dr. Malik,
mhm,
come on in February and give his perspective on the rhizotomy.
right.
I don't know if Brown does the rhizotomy or not.
Brown, no, well, I had asked Dr. Malik, and he said he doesn't do the balloon compression. And,
Right.
but
What is a
Dr. Brown,
rhizotomy?
Dr.
The
Brown is known
percutaneous,
for it.
percutaneous rhizotomy, there's 3 needle procedures. One is where they put the needle through the cheek and it's a heated needle. So what they're doing is burning the trigeminal nerve, putting a lesion on it to stop the pain from going to the brain. Or they could use glycerol, but they're having trouble getting the glycerol. And then there's a balloon compression where they use the balloon, press it up against a nerve, again to cause a compression. Then there's the gamma knife and then the MVD. So there's 5 different procedures if you have classic shocks.
Question, Tim, did Dr. Malik say why he doesn't do the balloon?
Yeah.
balloon?
No, most neurosurgeons
Yeah.
know what they're good at. And they'll tell you, yeah, you want it, go here. It's just like, God bless him, the fellow that passed. He came every March, drove down from Midland, Michigan for 10 years and talked to our group about the gamma knife. And he used 90 grades rather than everybody else uses 80, because he talked to the patient and say they'd be willing to have a little numbness to assure that they get rid of the pain. So he was a believer in 90 grades. So he would not do any more MVDs. He said he did 1 MVD out in California. Hold on, my neighbor's moving to Florida. I got to kiss her goodbye.
I'm sorry, I do have to sign off, but I'll see everybody next month.
Good night.
Hi,
Thank
Roseanne.
Take care.
Good
Bye,
night.
take
Sorry, I
care.
do have to
Let
sign
me ask you, your meeting, is it always the second Wednesday at
Yes.
7 o'clock?
We've done that for 25 years. So
Thank you very much for
I don't-
inviting me. I found out about this through Susan Mills of the California group.
Oh,
She sent it
yeah.
out to all of her members. So thank you for
what was your name again?
everybody.
What was your name? Pete will have it. What?
Judy.
Judy?
So,
Your last
yeah,
name?
but I've got to get going too, but I thank you so much. I look forward to hearing
You
more.
want the
Who's-
Galaxia?
It's
Do you
good
want the
talking to
Galaxia
you,
group?
Judy.
Do you want the Galaxia stuff? You need to email me your address and I can mail it to you.
Oh, God bless you. That's so generous of you, Tim. Thank you so much.
And I want to
It's
say,
nice meeting
this
you.
patient guide, if you don't have it, you all should have that. I should have brought that up earlier. I've got a basket full of them from FPA if you need one.
And I pray for all of you facial pain sufferers every night.
Same here.
I hope you get
Same
relief.
here. Thank you. Nice
Fun.
meeting you.
Likewise.
Nice.
Thank you.
Yeah.
Take care.
Take care. I'm
Yeah,
signing off too.
Okay, thanks.
Good night.
Good night.
You want to talk anymore, Tony?
No, I'm good. Thank you so much for everything.
We're still on video, so best if you want to talk separate, we could. All righty.
Well, I just want to ask one question. So you're saying that I could possibly have like what Lynn has because the wind bothers me?
Not that was just Tim's feeling after 25 years. Most people that had classic, but see, Lynn's didn't correct everything. It just corrected the shocks in V1.
Oh,
You don't have any shocks. See, she's back on low dose opiates. Well, I shouldn't talk for her. Let's separate.
no, I wouldn't say
Yeah.
anything, but yeah, yeah.
We're on
it's
video,
fine.
so remember we're on video. So, and I've got to call Pete to shut it down. So
All right.
we can talk.
Well,
separate.
all right, well, thank you for everything, but you know,
Yeah.
it's just a lot. I'm gonna try the upper cervical chiropractic.
Well,
I'm using,
yeah, I just ran into a fella, but again, that's mainly for classic. You can try it. And out here is the NUCA procedure. And I just ran into,
oh, that's what he said, the NUCA, that's
Yeah.
what he's gonna do.
yeah, NUCA helps people with classic. I don't have any experience. Let's see, trying to think. I don't think, I can't say that. Talk to him and tell him you have more of the TN2 or the ATN, atypical type, or neuropathic facial pain.
Okay,
Did I send you that?
yeah, I have it all. I read it with my mom. Yeah, we look at it.
I sent you that, right?
Yes,
Yeah, okay. I wanted to make sure. Some people, Katie downloaded it from the FPA site. Yeah, it can't hurt to try it. I think it's more applicable to the classic trigeminal
Okay,
TN1,
okay.
but I would still not wait. I would pursue somebody in the city. There's got to be. I asked my doctor. He didn't know anybody out there. He knew somebody in LA for a lady I'm working with out there. I mean, we can't make contact with him. I don't know why, but
No, I'm gonna ask around about that medicine because I really want to get that medicine in my hands.
yeah, I want
Yeah.
to, I'll put on video myself for those that are looking. If you're on as much as 240 milligrams of morphine, I also use this, one of these a night, which has 250 milligrams of glucosate sodium. And I take 3 of these, which is the same thing, 100 milligrams. So if you get if you if you get large doses of opiates like mine, 240 milligrams a day, you've got to watch out for your intestinal tract. I always say it'll turn to cement, if you know what I mean. And then you need to use a disposable enema to get your system working, or you'll end up in ER. So I don't want to chase you, those with ATN, away from use of opiates, but you've got to take things to keep your intestinal tract moving when you're on any type of narcotic. We like to use opiates. Narcotics kind of bad. Melody's calling me. Melody, we're still online. Melody, we're still online. I'll talk to you in a minute. No, don't worry about that. No, I know that. But I want to call you about something else. So I'll call you back.
Yeah, I gotta find somebody. I really do.
I shut her down and she's apologizing if she was talking too much. Hell, I'm not one that can complain about anybody talking too much. So she was just worried about that. I want to talk to her about something else. Yeah, she came to me locally here. She moved up from Ohio and I got my PCP to give her Norco. The only reason I knew about Norco, you can Google it, find out what it is. My PCP gave it to my wife for some, I don't know, goes back a couple of years, for arthritic pain or something else. And he was willing to give her a low dose, I think 5 milligrams, to see if it worked. But my wife, it didn't work with her system. She got an upset stomach or something. So for those other people that are listening to this video, when we put it online, Pete usually puts it online the same night, but he's got issues to take care of. Lynn's more important than that. Now, so in the next week or so, if you miss something, you'll have this video online. Somebody else is behind the P. You don't have to show up. I think we've got one other listener. Is somebody else there? You don't need to put your face on. I just don't want to.
Oh, it's Patrice, Nell Scribner's daughter.
Oh, Patrice. Oh, God. This is the daughter of a lady that had she was a support group leader for the group in Detroit. And this is interesting. You're here, Patrice. The lady that started that, even before Patrice, was, I'll say her name. She started at the Rehab Institute, and that's where Lynn and I met. And some of the people at the time didn't want to go into the city for whatever reason, a longer drive, and they lived out here near me. So I called Claire Patterson, who was working at, she was the president of TNA. And she said, Tim, in the larger cities, many of the times we have 2 support groups. So what we did is, for those that live to the north, we started our suburban Detroit group, and Nell took the people in Detroit and the people that live what we call downriver, down in South Lyon and Riverview and places like that. So we had 2 groups. Now that Nell, God bless her, has passed, and Lana Updike was working with Nell, her husband has been ill. She dropped off before Nell passed. We've absorbed the few people that were left on Nell's group, and they get I mail out a letter to about 10 people. That's better than 250 years ago. Anyway, yeah. And I think, well, how does the Zoom app work for you, Patrice?
Well, it works well.
Yeah. And we can give people, New Zealand didn't join tonight. She must have had trouble at work. She emailed me yesterday and said she was going to take her lunch hour, but it's kind of cool. Yeah, my wife and I were fortunate to in Australia, New Zealand. Yeah, we went to Japan.
How is Katie doing, the one that had the MBD?
Yeah, she jumped off. She's working with Dr. Oren Sager at University of Michigan, who spoke in April. He did her MBD. It was a 50-50 for her. She had the shocks. So, but I don't know why Doc said it was a 50-50. I think it was probably similar to yours, where there were arteries or veins near it, but she had the symptoms in the office visit. And so he said he was willing to do the MVD, but instead of, 80, 90%, no meds, no, and I'm talking immediate. If the MVD works, the gold standard, you're off, you wake up and the pain's gone, stop your meds. With Katie and the doctor, they're going to slowly wean her off because we're headed into the colder season here in Michigan. And I don't know that I ever asked her if the wind bothered her. So she's nervous, just like the lady whose husband had the balloon compression by Dr. Brown. She doesn't want to get off them too quick. So they're going to get off them quick. I mean, not quick.
I mean, Dr. Brown, he gave me better odds than 50%.
Yeah, I know. Most
Yeah.
of them, well, if you have classic, that's offline. Let's talk, Tony.
Okay.
Yeah, we spent hours on that. And I just do not here. Anyway, yeah, it's good input, Patrice. It was easy for you to use. Had you used the Zoom app prior?
Yeah, I had come on with you guys before several times.
Okay.
Usually on Wednesdays at this point, I'm at a class and I'm running a little bit late for it, but I did want to get on and continue my affiliation with the organization.
Oh, you'll see, we have over 300 members now. And what we have, 10 or 15 tonight. So you'll be on forever because Tim doesn't know how to go into the system and delete you. So I'm admitting my stupidity. I don't know, my son-in-law's got to teach me how to delete people. Once they say, take me off, I say, well, just if you get something from me, just delete it. Because I don't know how to delete people on our 330. There's only a handful that have asked to be deleted. Yeah, we've been, I think Lynn and I would pat ourselves on whatever and say we've been pretty successful in using our neurals here that we know better. And then there's those that, like Dr. Brown from the Facial Pain Association. Anyway, he used to be here in the Toledo area and then in the Detroit area. Now he's out in Long Island. I guess there's nothing else to say. Everything that I put in the letter is self-descriptive. But before you were hooking up with us, Patrice, had you ever used the Zoom app?
Yes. Mhm.
Oh, you had. I wonder for people that this is their first time, we try to make it easy for them. God bless Pete. He does the invitation. Then I just attach it to the cover note. And I think it's relatively easy. Is that, I ask you, Tony, was that the first time you've ever used the Zoom app? Was with us?
I just wanted to say goodnight. I have to go to work tomorrow.
Oh, that's right. But one question, was the first time you used the Zoom app with us for the support group?
Me?
Yeah, had you used it before?
Well, it took me a while to figure out how to get the camera.
Oh, okay. But we were the
It did
first.
take me some time.
You were the first one that you used the Zoom app for. Okay,
Yes, yes. It
so
took
your
me
trouble,
time, but I figured it out.
your trouble was getting the Zoom app off from the App Store rather
You
than
know,
problems.
my trouble was getting the camera to work.
Oh, okay. Yeah, I don't know about that. This is my wife's PC. She sets it up for me, so.
But I want to say good night, Tim. Thank
Yeah.
you. Thank you,
Yeah.
Patrice. Have a nice evening.
Take
Oh,
care.
thank you,
Thanks, Tony.
Tony.
Talk soon.
Talk offline, Tony. If you need,
Okay.
Yeah.
Okay, well, I'll give you a call.
yeah,
All right,
Thank you.
thank you.
yeah,
Good night. Thank you always.
yeah,
Okay,
Patrice?
yes, mhm,
yeah, yeah. It's so nice to have you. Sorry, I didn't recognize.
no problem.
Yeah. All right. You take care. Everything good for you?
I can't complain, Tim.
Except we lost your mom.
Oh my God.
Yeah.
get off.
Yeah. That was tough. Yeah.
When you're ready to leave, look for a button, red button that says leave.
Yeah, I see that. Then I have to
Uh,
call Pete and he'll shut down the camera.
And maybe, I don't know if you all are recording it, hit stop record.
Well, no, he has to do that. from his-
Gotcha, okay,
Yeah, he's at the hospital. I'm gonna call him. He can do it remote.
okay,
He didn't teach me how to do it, so.
okay. Well, you have a pleasant night and I'll look forward to our being in touch soon.
Take care, Patrice.
Okay,
Love you.
give
I
my
pray
best
to-
to Donna.
Yeah, I pray to your mom.
Bless you.
Yeah. Take
Take
care.
care.
Yeah.
Bye-bye.
Bye-bye.